There is a vicious stomach bug on the rise in the U.S. As of June 16th, the CDC reporting cases of the parasitic illness in 17 states. And since then, in 18 states, Michigan has reported a massive surge. So what's causing all this? Dr. Marc Siegel, author of the bestseller, The Miracles Among Us, and Dr. Nice to see you, and good morning to you. Specifically on Michigan, all right, on this parasitic outbreak. They're talking Cyclospora. I know you can explain that. 1,241 cases, of which 44 have gone to the hospital. Where's this come from, and what's your suspicion, Doc?
By the way, that 1,200 plus cases in Michigan, Bill, was 50 last year. So this is a huge outbreak in Michigan, across Illinois, Ohio, and into upstate New York. That's where the belt of this is. It's a single cell parasite that lives in the intestines. It doesn't get absorbed into your bloodstream, which is good news. You asked where it's coming from. Typically, it comes from mixed bags of lettuce that you buy, or it hides in the folds of raspberries, or it's in cilantro. It usually comes from imported produce or something in water, but we're not sure this year. This year, we haven't actually tracked the exact place it came from, but it spreads fecal-oral, meaning if you don't wash your hands thoroughly, or it hides in produce and you don't wash that thoroughly. That's what you got to do. The hand sanitizers don't work for this. It's soap and water. Most of the time it goes away on its own. You can get severely dehydrated. That's what I'm worried about in the heat. You can get anemia. You can get fatigue, but it will get better on its own. But then the problem is you start passing this parasite after you're already feeling better and thinking, well, I'm not going to be needing to worry about this. That's when you actually pass it on.
Okay, and antibiotics can do the job, too, in this case as well. I want to move to another story that's surprising.
Absolutely,
to me, okay?
if needed, absolutely.
Yeah. You think about, the advances in AI in medicine, and you're doing this in your office yourself. The World Health Organization is reporting that cancer diagnoses are on the increase. You had 20 million in 2024, 35 million in 2025 is the estimate. Why is this trend happening?
Really fascinating story. They're talking about two different reasons depending on where in the world you're talking about. In Africa or underserved areas, it's because of hepatitis B, hepatitis C, and HPV, human papillomavirus, causing cancer of the cervix or the throat. Those are the main things in underserved areas, and also that people aren't getting the care they need. So the diagnosis comes late or is missed, and the treatments aren't as good. Here in the United States, where the increase is not nearly the same amount. And we're talking worldwide, 20 million cases a year now, up to 35 million by 2050 per the WHO. So that's a big amount. Most of it is in Africa we're talking about. Here, the reason would be, and you already hinted at this, because of AI, because of our ability to find it early, because of our ability to treat it before it even becomes cancer or it's in the earliest stages. That's a really exciting advance here. So the case number's a little misleading in the United States. Overseas, and I forgot one thing, organophosphates and all the toxins in the environment that Kennedy's always talking about are a big problem over there.
Okay, Secretary Kennedy referring to. I want to squeeze in another story. I think this is fascinating. There's a group of people known as super movers. They're age 80 or older, and they walk really fast. And a study was done and found the following. The biggest takeaway is that super movers are about 50% less likely to develop cognitive decline than their peers. And then put up the benefits of physical activity, guys. Short-term, reduced anxiety, lower blood pressure, and then long-term, reduce heart disease and stroke and diabetes. Doc, are you telling your patients about this?
You bet I am. I am telling them, and I'm only not telling Bill Hemmer about this because Bill Hemmer is always exercising all day long, and so is Sandra Smith, by the way. But I'm telling my patients that the faster you walk, the more it is like an exercise. And your muscles are getting rid of waste and not feeding it to the brain. If your brain gets enough oxygen and it gets enough fuel, you're not going to become demented over time. There's a 50% chance that I'm right about that in almost everyone. Walk fast wherever you're going.
I love it. All right. Good advice, too. Doc, have a great weekend. Thanks for coming on. Marc Siegel, there he is. Thank you, sir. Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox 1.